Cauda equina is a neurological condition which affects the nerves at the base of the spine called the cauda equina nerves. It's a condition which generally healthy adults can get. The red flag symptoms such as problems with bowel movements, difficulty urinating, numbness in the groin area and sciatica on both legs are symptoms which should be recognisable by a GP or a doctor in the accident and emergency department. The important thing about cauda equina is if you start having this nerve root impingement, it has to be relieved very quickly, and if it isn't relieved very quickly, any of the symptoms, the bowel, bladder problems, or more significant neurological problems like paralysis can become permanent. There's about 100 cases of Cauda Equina Syndrome every year, and approximately 10% of those cases receive substandard medical treatment because there's delays in referring to hospital or delays in performing the neurological surgery that's necessary. As a consequence of this, these patients will be in a worse position than they would have been had they had the proper treatment and would be entitled to make a medical negligence claim. There is no cure once the cauda equina nerves have been impinged, but the purpose of neurological surgery is to relieve the impingement, so to take the pressure off those nerves, and most people can get most of their function back if they're subject to neurological surgery quickly. If your GP doesn't recognise that you have these symptoms, but you know you have these symptoms, you should go to the accident and emergency department yourself. If you think that your GP or your accident and emergency department have failed to refer you to a neurosurgeon promptly, and you've undergone neurosurgery, but you've not made a good recovery, you may well have a clinical negligence claim. At Your Legal Friend, we recognise that bringing a medical negligence claim is an emotional process, and so we will do our best to ensure that you receive the compensation to which you're entitled, that you do so as swiftly as possible so that you can get on with your life.